Hello there, I'm Dr. Tariq, and today I want to discuss a little bit about diabetes and some of its complications. Now, what is diabetes? Diabetes is a condition where either the body does not produce enough insulin or the insulin it produces is ineffective. There are two main forms of diabetes, and that is type 1 and type 2 diabetes. Type 1 diabetes is where patients do not produce enough insulin and they need to inject insulin to control blood sugar levels. Type 2 diabetes, which is where we find that 90% of diabetics are type 2, is where again the body does either not produce enough insulin or the insulin that it produces is ineffective. And these patients need to be controlled by either diet or exercise, medications, and sometimes insulin. Now, why is diabetes important? Diabetes is important because it affects 2.4 million people within the UK, it affects 180 million people worldwide, and it is a major burden in terms of ill health and death across the world. Also, diabetes is important because it can causes a lot of complications. Some of these complications are preventable. Now, the complications associated with diabetes can be broadly grouped into microvascular and macrovascular complications. Microvascular complications are where diabetes affects small blood vessels. Macrovascular complications is what I want to talk a little bit further about, is where diabetes affects the large blood vessels. Now, there are three major macrovascular complications in diabetes. The first is cardiovascular disease, which can present as chest pain and what the common public knows as a heart attack. Now, cardiovascular events are 2 to 4 times as common in diabetic patients as compared to the normal population. Not only that, the risk of death and long-term prognosis is poorer in diabetic populations. We also see that some of the risk factors seen in diabetes are also seen in patients with cardiovascular disease, and these include obesity, high blood pressure, and elevated cholesterol levels. This is why it is important that if you have one of these risk factors or you're concerned, to see a GP or a healthcare professional to discuss this further. The second is cerebrovascular events, which can present as a stroke. Again, cerebrovascular events in diabetic population are 2 to 4 times as common as compared to the normal population. And again, similar risk factors are seen in both diabetic patients and in stroke patients, where high blood pressure, elevated cholesterol levels, obesity are seen. So it's again important that if you have one of these risk factors or that you are concerned, to discuss with a healthcare professional who can advise you properly. And finally, the third major macrovascular complication of diabetes is peripheral vascular disease. Peripheral vascular disease is where arteries supplying the lower extremities are blocked, and this can present with pain and sometimes can lead to amputation. We see that in diabetic population that the risk of amputation is 15-fold greater as compared to the normal population. Now, having an amputation can have serious physical and psychological effects on the patient's well-being. So it is very important that diabetic patients see the practice nurse, GP or other healthcare professionals to have their feet and legs checked regularly, to have their pulses checked and skin integrity checked. And that concludes my talk on diabetes. I think it is very, very important that if you have any concerns or family members that have diabetes, that you discuss your concerns with GP, practice nurse or another healthcare professional. There is also a wealth of information on the internet and websites such as patient.co.uk and Diabetes UK.